Hi, my name is Glenn, and I've recovered from head and neck cancer, which were treated with chemotherapy and radiation. Today, I'd like to speak to you about neck lymphedema and the treatments I use to deal with its symptoms. So, what is lymphedema? Lymphedema is a chronic swelling that happens when lymph fluid is not moving well through the lymph system. Lymphedema started for me during the radiation treatments. I remember it began as an uncomfortable feeling, which I wasn't sure if it was the skin feeling different or if it was something I just couldn't quite explain. By the following week, my skin seemed to feel different, a little tighter. I noticed some swelling. It wasn't as severe or noticeable to me, but it was there. It's just interesting to have to notice this physical aspect on top of everything you're concerned about going on inside of your body. During the radiation, you can expect the skin on your neck to feel dry and tight. You may see some redness and feel sensitivity on the skin. The doctor told me to reduce these symptoms by making sure I kept my skin moisturized, to avoid tight clothing, scarves, and jewelry. My healthcare team gave me Aquaphor ointment to use daily. This helped me throughout and after the treatments. There's so much going on during treatment, it's easy to downplay this and let this not be so important. I tell other patients that it is important to follow the instructions of your healthcare team.
Hi, my name is Rita, and I'm a physical therapist here at Mount Sinai, and I'm also a certified lymphedema therapist. Over the past 6 years, I've worked with many patients who have developed lymphedema and undergone cancer treatment. As Glenn mentioned earlier, lymphedema is chronic swelling that occurs when lymph fluid is not moving well through the lymph system. It starts to build up in the tissues and leads to swelling. When the lymphatic flow is interrupted, as in the case of surgery or radiation, fluid collects in the soft tissues and results in lymphedema. Not everyone develops lymphedema, but unfortunately right now there is no way to prevent it. However, there are exercises you can do to reduce swelling and the side effects that affect your appearance and mobility. Exercise is important because muscles help increase the flow of lymph fluid. Muscles contract and push the fluid through the lymph vessels, which helps move it away from the swollen area. Doing gentle exercise during treatment can help you keep and maintain full range of movement.
I wish I had known about all of the recommended exercises from the very beginning. I know it's difficult. I know at times it feels like it's almost impossible, but you need to move your neck and you need to move your whole upper body, and just stretching can help too. Not doing these simple movements just one time in 2 days made it almost impossible to start again.
Now let's walk through some of the gentle daily exercises you can do. If at any point you feel discomfort, pain, please take a break. Any movement you can do will help. The first exercise will be diaphragmatic breathing. While sitting in a comfortable chair, place one hand on your chest and the other on your stomach. Take a deep breath and imagine filling up your stomach with air. You should feel the hand on your stomach gently rise as you're breathing in. Slowly breathe out for a count of 4. We recommend you repeat this breathing exercise 3 to 5 times. The second exercise is shoulder rolls. Sitting with good posture, relax your shoulders and gently roll your shoulders forward in a circular motion 10 times. Then take a small break and roll your shoulders backward in a circular motion 10 times. Remember, this exercise should be pain-free. The next 2 exercises will help maintain range of motion in your neck. Please remember to only move to your tolerance and to stay within a pain-free range. Let's start with head tilts. Gently move your right ear towards your right shoulder and hold for 5 seconds. You may feel a gentle stretch along the left side of your neck and shoulder. Then slowly bring your head back to center. From there, you want to now move your left ear towards your left shoulder and hold for 5 seconds. Repeat this 5 times on each side. The next exercise is neck flexion. Gently bring your chin down to your chest, looking down at your toes. Hold for 5 seconds and repeat 5 times. Here you may feel a gentle stretch along the back of your neck and your spine. All of these exercises can be done throughout your day while sitting at your desk, watching TV, or even waiting for an appointment. Now let's work a little bit on your shoulders. Shoulder abduction is a good exercise to do because it helps open up your rib cage, which in turn helps with breathing. We're going to do this exercise in standing. Let's start with your arms down at your side. Slowly lift your arms out to the side, thumbs facing up. Lift your arms over your head towards your ear. Gently lower your arms back down to your side. Repeat 10 times. With this exercise, it is important to stay in a pain-free range. Do not lift your arms higher than what feels comfortable. As time goes on, you should be able to lift your arm a little higher. The next exercise is an important one for posture and engaging your back muscles. Shoulder blade exercise can be difficult at first since it's hard to see and feel, but with time and practice, they will get better and stronger. Start with your arms bent at the elbows and tucked to your side, and then slowly rotate your arm outward, gently squeezing your shoulder blades together. Imagine that you're trying to squeeze a pencil between your shoulder blades. Hold for 5 seconds and return to the starting position. It is important to try to relax your shoulders and not let them lift up while squeezing. Repeat 10 times. The last set of exercises we're going to do are for the muscles on your face. I do recommend doing this in front of a mirror. You want to do the movement as tolerated. We do not want to cause the muscles to fatigue. First thing you're going to do is smile with your teeth showing. Repeat 5 times. Observe if one side is lagging behind or not moving much at all. Do not be discouraged. With time and practice, this can get better. Next, we're going to smile with your mouth closed. Repeat 5 times. Now I want you to try and yawn. Open and close your mouth slowly. Again, please stay within a pain-free range and repeat 5 times. With this exercise, you want to observe how much you can open your mouth and if it is symmetrical. Next, you're going to gently squeeze your eyes closed and slowly open. Repeat 5 times. Lastly, you're going to lift your eyebrows. Repeat 5 times. Remember, all exercises we have gone over today should be done slowly and gently. Please stop any exercise if you feel pain or fatigue. Since not everyone develops lymphedema, it is important that if you notice any of the following symptoms that you talk to your medical team. Swelling in any part of the head and neck that may feel hard to the touch, a feeling of tightness of either the skin or muscles around your head and neck, decreased range of motion in the neck and shoulders, change in sight or hearing, a change in breathing, swallowing, eating, or speaking, a constant feeling of being stuffy or congested, or pain in the ear. If you experience any of these symptoms, you may benefit from a few sessions with a certified lymphedema specialist to learn manual lymph drainage. Manual lymph drainage uses a series of gentle circular massage strokes to promote lymphatic flow. You can be seen at any point during your cancer treatment or even months after. Most treatments last anywhere from 2 to 6 weeks. The treatment time will vary based on what the individual needs. During your treatment session, your therapist will go over ways to prevent injury and infection to the head and neck region, instruct you on further exercises, teach you how to do manual lymph drainage, and finally, the therapist can also help you determine if a compression garment is needed. With treatment, you should expect less swelling as well as improved range of motion.
I was on the advice of my social worker. I decided to look into the lymphedema therapy just because it was getting to the point where I noticed it more and more each day. It was not getting better. It wasn't going away on its own. Your doctors, of course, are in the best position to help you fully realize your potential for healing. And take notes, if possible, have someone with you who can be a second set of ears. It's important to communicate with your doctor throughout the radiation treatment. Sometimes we don't want to bother the doctor or the team, or sometimes you just stop paying close attention. In the case of lymphedema, the sooner you get the therapy, you can start to address it.
So what do you need to access a certified lymphedema therapist? The first step is talking to your doctor and medical team. They can then give you a referral for physical or occupational therapy. They may also have recommendations on a therapist. If not, you may need to call your insurance company and find a list of local physical therapy practices. It is important that when you call different practices that you specifically ask for a certified lymphedema therapist. Another option is going to the National Lymphedema Network and searching their database for a therapist in your area.
If you don't feel strong enough to advocate for yourself, find someone who will. There are so many people out there who would love nothing more than to be able to help you get through this. My relationship with my social worker was a valuable resource. She provided a listening and supportive ear. The psychological part of getting through the head and neck cancer treatment and recovery is an important one, and having someone there to talk to about what is going on emotionally and anything else that gets in the way of getting through the treatment is vital. Remember to follow the directions of your oncologist and your team. For example, do the exercises, moisturize your skin, and keep moving your neck. All of these instructions will help in the long run. So give this your best shot.
Thank you so much for watching this video. Hope the information was helpful. Please speak to your medical team if you think you would benefit from a referral for lymphedema therapy.